morning, everybody. Thank you for joining us from wherever in the world you're dialing in from. I hope everybody's safe where they are. We have a really exciting webinar for you this morning, presented by one of our women business owners, certified women business owners, Judy Snaski, and she will be moderated by Diputseng, another of our certified women business owners. We Connect International is a global organization that certifies women business owners and then introduces them to corporates. We continue to be very busy working with women business owners and corporates in South Africa, and we're really delighted to put on this webinar for you this morning. I'm now going to hand over to Diputseng, who will introduce Judy and just tell you about how the session is going to run. Thank you so much.
Good morning. Thank you very much, Jean. My name is Diputseng Manamela, and I'm from Disassembling Consulting Corporation, which is a safety and environmental management consulting company. Yes, today we're having a webinar where we are going to look into understanding sanitizers and disinfectants. You will agree that the end of 2019, the beginning of 2020 has been very tough to everyone around the world. We talk now of COVID-19, and we have Judy Snaski here, who is the CEO of Blendwell, a company that manufactures cleaning chemicals. I'm going to allow her to take us through presentations. We will have some pauses in between the slides where you can ask questions. You are, however, welcome to just type your questions and I will see them and I will engage you with those questions. Thank you. Over to you, Judy.
Good morning, everybody. Welcome. I hope I'm going to teach you something worthwhile about disinfectants and sanitizers this morning. So let me just share my screen with you, and then I can take you through the presentation. Sorry, my screen is not clicking. Ah, there we go. So what do we know about coronavirus? You've all seen this picture, I can't tell you how many times, presented all over the world, and you've all heard a lot about it. We know it's highly infectious, we know it is a virus, and it has a fat layer. And the fat layer in this particular virus is what attaches to the host. Once infected, the virus duplicates really, really quickly, and the body begins to attack itself. The virus can remain on the surface for up to 3 days, and this is where the danger really lies. And a person may not display symptoms for 2 weeks while still spreading the infection. Okay, so the virus means that it is not effective with antibacterial cleaning agents, remembering that a bacteria and a virus are 2 different things. To give you an idea of the number of hours coronavirus can survive in air and on different surfaces. So recently they've shown how the airborne virus sticks in the air, and you might be seeing it on the news where somebody's coughed in the supermarket and how those air particles can hang about for quite some time. The other interesting ones, and this is where we handle things in our day-to-day, it might be your box of cereal or pressing on a lift button if you are one of those people that are out and about and working. So cardboard up to 24 hours, copper 4 hours, plastic up to 72 hours, and steel 48 hours. And those plastic and steel numbers are really, really high. So you need to be mindful of that. And when bringing in, if you are in lockdown, bringing in anything into your homes or your spaces, because it is possible, depending on what's happened in the chain, that the virus could still be around. So what works against the virus? The perfect scenario is a combination of cleaning plus disinfecting. So you have seen how washing your hands is most important. And the reason washing your hands works so well is because the soapy water breaks down that fat layer that is there on the, that the virus has. And again, disinfecting, we know that those alcohol disinfectants are really effective against the virus, and they also break it down. If it's at all possible and you are exposed or in the outside world, as we can call it at the moment, then a combination of the two is really ideal. So cleaning alone is not always enough. If you are limited by what resources you have, then the options for cleaning are, apart from a hand soap, you could use something like a dishwashing liquid or a bubble bath or a shower gel. Any of those would have the same or similar effects to a hand soap in helping to break down those fats. The hand wash procedure, so there's many that you've seen out there. Again, it's all about time. So how long should you be washing your hands for? And we say in our hand wash procedure, we say 15 minutes plus a sanitizer. If you're only using hand washing, then what you need to do is do at least not 15 minutes, 15 seconds. Then you need to do 20 seconds. And how long is 20 seconds? Well, we suggest you sing happy birthday to yourself at least twice. So the difference between cleaning, sanitizing, and disinfecting. Cleaning is when you remove something off a surface. So you're taking soils, debris, dirt, or dust from a surface. Sanitizing is when you are killing some of the things on the surface, but not necessarily everything. And disinfecting is when you have an absolute kill rate of all bacteria, viruses, fungi, and other possible pathogens that might be on your surface. So the difference between the sanitizing and the disinfecting is that the disinfecting is absolutely thorough and sanitizing gets most of it, but not necessarily all of it.
Okay, thank you, Judy. Can we just, on that slide, take a little bit of a pause and see if there are questions from the participants? I don't see any questions so far. Perhaps you talked about fatty layered virus, and I mean, typically thinking of fats, can hot water alone destroy the virus?
Yeah, so hot water can be very effective because we know there's an effect of temperature on the virus. So once we move above 26 degrees, the temperature has an effect on the virus. But if you were wanting to use hot water, you would need to have it at a really, really high temperature. So if you had boiling water and something was boiled in water for a period of up to 10 minutes, then you could be certain that it would be effective. So it's kind of like your baby's bottles when you clean those. The principle is the same.
Okay, I guess in respect of safety, and because we are cleaning, hot water alone will not be an option because of the temperature that one needs to expose the virus to. I will allow you to proceed, and believe that more questions will come as we go on in the presentation. Thank you.
Thank you, Dr. Singh. So talking about different types of disinfectants, everybody out there has heard about the alcohol. Some people say 60%, but in my research, everybody is specifying specifically 70%. The higher the concentration of the alcohol, the quicker the kill rate. And the reason alcohol is the most effective is because it does the job so quickly. However, there are other types of disinfectants that you can use, but I should stress that these other types of disinfectants are there for surfaces and not necessarily for safety on skin. So your sodium hypochlorite type disinfectants, that would be your bleach or your thick bleach or your toilet disinfecting type products. Any of those would be effective. The sodium hypochlorite is very, very effective on the virus, as is hydrogen peroxide, or sometimes combined with an acid to become peracetic acid. And then we have another one, which is a combination of water and salt, which creates a liquid that we call analyte. That is also very effective in breaking down that fatty layer on the virus and therefore disinfecting the surface. So what do we need to see on the label? You need to obviously have your product's name. You need to have active ingredients. It's a legal requirement. So all of these are legal requirements to be seen on your label. So that, and this is a standard set by government legislation for disinfectants. You need to state what the active ingredient is. So in this particular case, it's a propyl alcohol. There are two types of alcohols being used currently, and one is the propyl type alcohol. The other one is an ethanol. So I just need to point out here that we've seen some very dangerous practices with everybody suddenly becoming a hand sanitizer manufacturer. And there are certain types of alcohols that have been put into hand sanitizers that are not actually safe for human consumption. So you need to be really careful about the product that you use and make sure that all these legislative requirements have been met so that you know you do have a product that has safety factors built in for you. I've come across people using printing grade ethanols, which is not at all fit for human consumption, and things that kind of smell like alcohol, like acetones and methylated spirits and things like that. So please, when you're out there, make sure that what you're getting is from a reputable source. And, you know, you could be putting something onto your skin that could do you more harm than actually catching the virus if you're a fit and healthy person. So you need to see company details, the physical address of the manufacturer. All of these are important because the products need to be traceable. They need to be traceable through a batch number. It should have an expiry date on it. An expiry date is important because you need to know that it's still working and still able to work as a product. You will look out for your SABS or other certifications on your bottle. And then, of course, it needs to tell you how to use it, what to do in the event of something going wrong, and also how to store it. Storage of your cleaning products is very, very important. That cool, dry place, locked separately in a room. So it's locked separately away so that it's not able to contaminate other foodstuffs or anything like that, and to keep it out of the reach of children because sometimes they're nice and colorful and pretty. And the cool, dry place is important because especially things that contain alcohol or your bleach type products can quickly dissipate and become less effective if they are not stored properly. I'm sorry, I've lost my, that was a bit quick. Okay, so let's chat about the important elements of cleaning. There's always 4 factors that we need to take into consideration when cleaning and disinfecting. One is the chemistry. The chemistry is your product. What are you cleaning with? Is it fit for purpose? So you will find this on the label, or you can check it on the internet, but the cleaning product needs to be correct for what you want to clean or disinfect, and it needs to be suitable for the surface that you are going to be cleaning or disinfecting. Otherwise, damage can be caused to whatever you may be cleaning. Temperature, I spoke about after the question from David saying earlier. Our temperature is important. So cleaning, and especially in hot temperatures, if you have someone in your home who becomes sick and you need to do their laundry, please remember it needs to be done at the highest possible temperature setting that you can use. And that is to ensure, again, that virus that's sitting on the bedclothes is properly taken care of. Remember as well, when you're taking off sheets and blankets or duvet covers, that you really need to not shake anything around, because we know this area, that this virus can become airborne or settle onto different surfaces. So containing that with every move that you make is really, really important. The mechanics of cleaning, so that is, what are you going to use to be cleaning with? So if you are disinfecting in your home, chances are it's going to be wiping down surfaces with a cloth, or you may have a steam cleaner, or alternatively a spray bottle. So those are your mechanics, what you use to get the job. Your vacuum cleaner, for example, would be part of the process as well. And then time. So time is a very, very important factor, and I'm going to mention it several times during this presentation, because when it comes to disinfecting, time is critical. The fact that the product needs to have enough time on the surface that you are disinfecting is very, very important, because it's time plus the concentration, that's how you've diluted your product or used it as is, on a surface that will determine how effective your kill rate is.
Thank you, Judy. Before we proceed into the steps, I have received one question. It says, what is the percentage of chlorine that is required?
Okay, so what we would normally do in a standard bleach, it depends. So they will tell you, depending on the concentration of a chlorine product, what the actual concentration of the product is. So for example, if you were using one of our products, we make a 5%, we make a 5% bleach, and we know that is effective at 100:1 dilution rate over a 5-minute time period on a clean surface. So you need to look at the product on the label and check the recommended dilutions that are appropriate for the particular product. Not all of them, not all chlorine-based products contain the same amount of chlorine.
Okay, and maybe just to add, it also dependent on the type of application as well. Because when you clean a metal surfaces, wood, floors, it can withstand different percentages of your chlorine. So application is also very important. The other question that just came in now, what advice would you provide to us as users and the society post the lockdown in terms of how we live our daily lives with schooling, churches, crowded areas, specifically how to protect our families?
Okay, so I can give you an example of how I'm living right now, and I'm going to assume that post-lockdown, more people will be going out into the world and will be exposing themselves to the virus. So inside our home, I know at this point in time, there is nobody sick. So we keep everything clean. We make sure that everything is properly cleaned and our surfaces are disinfected. Anything that comes into our home, so it starts with myself. So I will come home from work at the end of the day. I walk into our home. The very first thing that I do is I go and I have a shower. And I clean myself from top to bottom. And the clothes that I have been wearing are separated out because there might be contamination on my clothing. While I am out during the day, I practice frequent hand washing. I make sure that the areas I'm in, and that's our current building, that we have a disinfecting process that is adhered to several hours in between, where the high touch areas like the door handles, where people are going in and out, the kitchen, bathrooms, are frequently wiped down so that can be disinfected. So while we're out and about, be very, very careful. And once we get into our home setting and we've got everything that we've brought in, so my cell phone will come in, the cord that I have with my phone. Once I've cleaned myself, I then go to those particular items and I wipe them all down with disinfectant as well to ensure that we're not bringing anything in from the outside. And you guys should be practicing this too when you are doing your visit to the supermarket or a doctor's room or anywhere like that. So remember, when you're out, you're going to be bringing something in. I think that would answer the question.
Yes, definitely it does. I hear we need to just keep disinfecting and cleaning ourselves and what items we use. Maybe just to add a little bit to follow up, how about food items when one comes from the grocery stores?
Yeah, so think about it. And we would like to believe and would like to be certain that everybody involved in the food process, and I know that the fact that we deal with a lot of food manufacturers, they have definitely, I mean, they always hold very high standards, but have definitely taken it to a new level. That they are out there and their processes are properly cleaning and disinfecting. But if you come home with that carton of milk, for example, you don't know, once it's left the original processing plant, it's come into the supermarket, what sort of a standard of hygiene the supermarket is practicing at the moment, and how well it's being checked and monitored, because that milk has got to get into a fridge on a shelf, and somebody's got to be moving it, you know, and then from there it's going through the process and it's going through the till points, and we see that everybody behind the till points are sitting there with their sanitizers, so their hands are disinfected. But I would, again, bringing those things into your home, wipe them down. So if you have a bit of alcohol that you spray onto your cloth and you wipe it down with, or a bleach solution or a solution of analyte, that is absolutely ideal to wipe it down before you pack it away into your own space. Shall I carry on, Dibize?
Okay, I'm getting it.
Are you getting more questions? Good.
I'm not hearing you. Yes, we are getting more questions. I'm gonna just pause a little bit so we continue with the presentation. I suspect that some of the answers, some of the questions can be answered through the next slides. So precautionary approach. You may proceed, Judy.
Thank you very much. All right, so I am going to go through the next parts of the presentation with a 5-step process. Should your office or somewhere in your home become exposed, what would need to be carried out and how it would need to be dealt with after we've been exposed to the virus. So you know of somebody who is sick and you have sent them home, and now we need to clean and shut everything down with a cleaning procedure for the next 72 hours, or someone in your home has been sick. If somebody in your home has been sick, you need to leave them to clean for themselves. So if it's possible for them to have their own bedroom and bathroom area, and really that area will be completely left alone until the person becomes well again. So in an ideal world, you would isolate them within your home and provide them with the necessary stuff that they need to clean up after themselves if they are able. Okay. So the first thing we need to do is assess what needs to be done. What does the space look like? And that is going to depend on what kind of a space you have. I'm just trying to get mine. Right. So you need to create a plan for cleaning. I'm going to use this as though it's a contract cleaner's example. So you would need to decide, first of all, you're going to have a plan for both cleaning and for disinfecting. You are going to have a look at what you are cleaning. So what you are cleaning and disinfecting will determine which products that you use. So you need to make a choice of your products. If it is an environment where somebody has been COVID exposed, you need to ensure that your cleaning staff have the correct PPE, the correct protective equipment, and that will come in the form of gloves, aprons, shoe covers, head covers, goggles or masks. You will decide what equipment you will be using. So from various brooms, brushes to spray bottles or spraying equipment. And you will have a look and assess very carefully at the different things that need to be cleaned. So you would have a breakdown by area. So I don't know if you can see, it's a very small document, but we will go through one a little bit later. So what needs to be done on the floors, what needs to be done on the walls and doors, what needs to be done on the light fixtures. And so you would go the desks, or if it's a bathroom, toilets, etc., and put down a complete process for the area or equipment, the chemicals and the dilutions they need to be done at, how often it needs to be done for, a brief outline of what needs to be done within that process, and then who would be responsible for that. So once you have that, you then need to plan prior to your disinfecting. And we can't clean an untidy space. So everything needs to be removed from the space. So you can see here, for example, we have an office, and in this office, there's no computers or phones or anything on the desktops. And the reason is the computers, phones, etc., have been taken away. They've all been individually wiped and disinfected and stored together in a single place once they're ready. And then you're ready to come in and clean the surfaces prior to disinfection. If we are doing a bedroom, for example, you would need to remove all the linen and bag that. You wouldn't take linen out of a room not in a bag. Remembering again that whatever we're taking out of a space that has carried the infection in could be moved to another space. Anything that is removed, that is waste from these spaces, needs to go into dustbin bags, double bagged, and removed out. But we'll talk a little more to waste as we go along. Then you need to determine your cleaning program, and top to bottom cleaning of everything that is in the space, the walls, the floors, balustrading, with specific attention to the areas that are high touch points. Okay, your lift buttons, your biometrics, balustrading, escalator, rubber handles, all those kind of things. If you are servicing or providing a cleaning service, these are the particular items that you need to pay special attention to and up the frequency of cleaning or wiping down and disinfecting these every day from where it used to be. Then we go to the disinfecting process, and again, it depends on what the facility looks like. So once again, I'm going to remind you how important time is. In the picture here is a foaming application, all right? So they push the cleaning product through the foamer so that it creates foam on the surface. What the foam on the surface does, it allows the product to stay on a vertical surface for the required period of time to obtain the necessary level of disinfection. And that's why foaming is so effective, because you are able to get those vertical surfaces. Remembering that when you don't have something that's sticking to the surface, your time could be of the essence when it comes to proper disinfecting procedures. So here you have a close-up of the cleaning schedule, so you can properly see it. So very important, what you need to clean and at what percentage. A combination of a detergent, which is a cleaning agent, plus a disinfection. If you were going in for a once-off deep clean after a COVID episode, you know, your frequency would be a once-off, and then you would have the outline of your procedure. As many details as possible, and also making sure that you have all the necessary equipment in place, and again, who is responsible for that. And then once it's all been done, somebody needs to do some form of verification. So a checklist and a sign-off is a very good idea, so that somebody has checked what has been done and where it has been done. Remember, it's very important in terms of protecting your workplace, your business, and your staff to have a monitored, documented procedure in place for cleaning. And as we move out of lockdown, we are going to see how important this this will be. I mean, it's going to be absolutely critical to those people who will continue running their businesses, that all these necessary measures are in place for the health and safety of those people in these environments. So apart from time, once your environment has been cleaned and you've left it for the 72 hours to be absolutely certain, that would be a fair assessment. There are various tests that you can do, and one of them is swab testing. That's what you can see in the picture here, and that gives an idea of what is left on the surface after cleaning and disinfecting has taken place. Having a look at some forms of personal protection equipment. Yeah.
Let me interrupt there. I think that the steps are very important, and let's allow for questions on those steps and what we have discussed so far. I'm receiving a question which is related to sanitizers.
Yes.
Can one use sanitizers on eczema infected skin, or will it worsen the skin condition? I think it's more around allergies and skin conditions. What advice can you provide?
Yeah, so that's a very important question, because alcohol destroys the fat of the virus, you know, and that's what your sanitizer is based on. And alcohol will do the same for the fat that's in your skin. You know, we all have a level of fat in our skin. So constant use of alcohol disinfectants will have a drying effect on your skin. And if somebody has eczema or psoriasis or one of those sensitive types of skin, they will further irritate the skin by continuing to use sanitizer. So I do suggest that a good thick layer of moisturizing cream while you are using your sanitizers all the time to try and counteract the drying effect. But you do need to be mindful that it actually can make the condition worse.
Okay, and can we wash down, can we dilute sanitizers?
You can dilute sanitizers. It's just very difficult to say at what particular points the sanitizer would be effective. Remembering that the concentration of the product and the amount of time it spends on the surface is what's important. You know, so previously for the food environment, I'll give you an example, we were achieving the necessary kill rates with alcohol plus an additional ingredient over a 1 minute period of time at a 35% concentration. So it's all relevant. If you want to be certain that it's instant, you need to be working at that 70% mark. And when we say instant, it's less than 10 seconds is what we mean by that.
Okay, we are 37 minutes into the presentation. I'm just going to allow 2 last more questions and you'll proceed. In the table that you presented on earlier, on different, for how long the virus can last on specific surfaces, you did not mention wood, leather, and ceramics. Do you have an advice on that?
I don't. I would actually have to go and look that up. I think what they've done is they've taken the most common ones where it would be obvious and that the virus survives, and we need to be mindful of that. But I'm sure we could go and look that up online if we wanted to be certain of those. So.
Okay, no, that's fine. There is one question here. I would presume here we're talking mainly cleaning products, and yes, this question you'll just advise. Can analyte be used to disinfect the throat?
So it does not have a medical registration, so I would not be advising that as a I would not advise that as a usage without that registration.
Yeah, okay, no, thank you very much. Yes, it will, I mean, something that you will use for internal use. Most of the product will say for external use. If anything that one would want to use internally, you need to get a medical advice before you can
Yes,
do that.
but what I can tell you about analyzers, it's a hypochlorous acid, and your body itself does produce hypochlorous acid. So that is what makes analyte so safe. Because it is something that's naturally occurring within your body anyway.
All right, okay. No, thank you. You may proceed.
Thank you. All right, so the handling of waste, I did mention it earlier, and that is everything that's in that particular space needs to be bagged, and then it needs to be bagged again. If it has come into contact with a possible COVID contaminated environment, before it goes into normal waste, it needs to sit for a period, locked up, sit for a period of 72 hours before you put it into normal waste. Putting it into our normal waste without waiting out the time period could contaminate waste, and especially in South Africa and other African countries, we have lots of people who are scrambling through waste all the time. You do not want to be passing the virus on unintentionally because you put it into a dustbin bag or a rubbish bag. Okay, so the training of cleaning staff. So again, training is very, very important because people need to understand the importance of the cleaning and the disinfecting. They need to understand how important dilution is. We need to make it as simple as possible for people to be able to dilute product. And again, how frequently they need to clean and why they need to clean so frequently and how they need to clean when they go into the areas. And my advice on training staff is every member of cleaning staff will need to be retrained when they go out into the workplace and continue their cleaning roles. They will need to be trained to new levels. And once we think they are trained enough, I suggest you just go and train them one more time. Train, train, and train. It's very important that we get people into the new habits of cleaning and ensuring our environment is safe. So the recommendations for public spaces or places of work, as you enter into different areas, have disinfectants readily available. So as people move from one space into another, ensure that they are able to sanitize their hands. Make sure your bathrooms are properly stocked. Your bathrooms need to have hand soap, they need to have hand sanitizer as well, and preferably paper towels that can be disposed of and thrown away. Other kinds of towels could be spreading the virus, and at this point in time, you don't want to be doing that at all. Going forward, and like we are doing currently, we avoid meeting in large groups, and sick people are encouraged and must definitely stay at home. Until we know what they've got, we don't want that possibility of people coming into the workplace and infecting us again. And where possible, we will have to allow remote working and telemeetings to still take place off-site. So that's just a summary of the sources I've used for this presentation and where we got some of the information from. And saying I'm ready if there are any more questions for me.
Oh, okay. It went very quick than I anticipated. I've got I think it's 3 questions. One, it says, where can I get the SOP for disinfecting homes, house, office, or even the checklist?
If you have a look online, there are lots of resources available for cleaning. Otherwise, you would need to basically create one. Have a look at all the different elements that you have within a home, and you start. Use the document that we put in earlier in the presentation on how to go through the procedure, and you adapt that according to the needs that you would have. There's lots of
maybe just to add, I mean, I don't think there will be a generic SOP, because we have spoken about different applications. We have spoken about time that is required to ensure effectiveness of the chemical that one is using. So depending on what you are targeting at that moment, then it will require a specific way of applying the specific chemical and the time associated.
Exactly. So, you know, if it's an area, say a bathroom, and you choose bleach as your disinfectant, and then you would look at your product that you have, you would set up the dilution according to the requirements of the labeling. Again, read those labels, have a look at them, make sure that you are adhering to the dilutions that are required there. And that becomes part of your SOP. So it depends on your product choice. You know, there isn't a generic out there. It does have to be created by product, by space, by requirement.
Okay. And from a safety point of view, handling of these chemicals is very important. You have touched a slide on PPE, different types of PPE that are required for when one uses cleaning chemicals more specifically. And how do we then clean this, the PPE from overalls and mops and so on?
Oh, that's a great question. So the PPE required, and moreover, what I did was I put PPE that would be required if somebody was going to clean in an environment that had been possibly contaminated by COVID. However, your PPE is again according to the specific area that you would be cleaning. And in some cases, we would use disposable PPE. So it would be a set of gloves, for example, that comes off and then is disposed in waste. So important things to remember when it comes to PPE. If it's disposable, make sure you dispose of it correctly. If it is reusable, make sure that you are correctly disinfecting it and cleaning it and making it ready for the next use. Make sure PPE is not shared between staff. Each staff member needs to have their own set, and going from time to time and day to day, or moving from environment to environment, you may need to have more than one set of PPE so that you can be possibly prepared or properly prepared in each case. So in terms of cross-contamination, your PPE could cross-contaminate and your cleaning equipment could cross-contaminate as well. So please remember to properly clean off all your equipment, and also not to share equipment from site to site, because that could also cause cross-contamination.
All right, so which means then the first P in the PPE needs to start to be active, because it says personal. It's personal protective clothing, so you can't share. So that first P now, we must use it properly.
Yes.
Okay. There is one question here that talks, it refers to groceries. We touched a little bit on groceries. The question she says here, can you advise a solution to wash down grocery? As I heard, use sunlight, jig, and hot water. Not sure if this is correct.
Yes, so one of the solutions that I make use of is the analyte. So that is the electrolyzed water, and that is absolutely great for wiping down your groceries with, because it is so safe and doesn't, you know, you're not going to have any residues or anything left on the surface that could possibly harm. Whereas if you're using sunlight, you need to be properly rinsing, because if we use analyte, we are just able to wipe it down and leave it on.
Okay,
that would be my recommendation.
The analyte, where do we get it from? Is it in one of the cleaning chemicals, or is it chemical on itself?
Yeah, so we do supply analytes. It's, you can find it. There's a website called Wipe Out Sanitizer, or alternatively, you can Google analytes, and you will be able to find providers of analyte type product.
All right, okay. One thing that I missed that I feel it is important is storage. Storage
Yes.
of these chemicals. How do we store them to ensure that they're still effective against what we are trying to eradicate?
Very, very important. And that piece is in your label information, but it's pretty generic. So generally, you store cleaning products in a locked, separate room, separate from food stuff. You need to keep them in a cool, dry place. So many things like your alcohols and your bleach type products, they can become less effective if they are stored in a warm space or if they become exposed to sunlight. So please, if you have a small sanitizer that you travel around with, don't leave it in the heat in the middle of your car for heat exposure. It will make it less effective than if you look after it and store it properly in a cool, dry space.
All right. So that labeling, it becomes more important even here.
Very.
There is also another question that touches to that, which talks about clients are asking for product specification and safety data sheet, which part of which will be in the labeling, but the bigger safety data sheet, every manufacturer needs to be able to provide that because it gives you handling procedures, storage, how to deal with the waste, how to treat the person who has ingested or has had the product dropping into the ice and so on. So is this something that we say, we have seen new entrepreneurs coming in with sanitizers, most not labeled. What kind of advice can you provide? And why do we need a safety data sheet?
Okay, so safety data sheet, or its other name is an MSDS or material safety data sheet, is very important because it gives you all the details on the product. So it is the document that you would refer to if there was an accident or something that went wrong within your organization. So any reputable cleaning product manufacturer will have an MSDS. It has 16 points on it. We always have 16 points on it. The manufacturers, I'm not going to remember all 16 of them, but the important things are the manufacturer's name, the ingredients that are in it. So that would become important if somebody drank it or there was something that spilled on them and burnt their skin. That would be the document that you would take with for medical help. If it becomes, if it spills or gets into the water system, or if there's an accident on a vehicle and there is product spilled on the road, that is when that becomes necessary. Also, if you are doing any exporting of product whatsoever, that material safety data sheet is critical, and any transporter needs to have those documents go with it as well, if you're going to be doing things correctly. So yes, you will have a data sheet. So that's one that gives you information similar to the labeling. That is what it is, how to use it, that kind of information. And then the safety data sheet that gives really all the technical stuff that covers all eventualities.
Okay, basically a safety data sheet or material safety data sheet, it's like your CV. It tells us who you are and how we should handle you if you are a chemical. So basically, in short, that's what it is. You need to know what are you dealing with. Hence, if all the clients will ask you for a safety data sheet. I see also words of appreciation for the informative information. Thank you very much, Judy. And one more question. Is spraying effective if not combined with cleaning first?
Yes. So let me answer that question with what it would depend on. So spraying can help if you have an already clean surface. So when the disinfectants are tested for their efficiency, they are tested on a clean surface. So we are making the assumption that you are going to be disinfecting an already clean surface. If you have a surface that is full of dirt, your disinfectant cannot be as effective as it needs to be, and then you need to clean first. So, you know, if, for example, you're going to do a wipe down of your laptop, assuming there's no clumps of porridge or whatever might be on it, you know, it's a fairly clean piece of equipment. A single wipe with the disinfectant should be absolutely perfect. So remember, it depends on if there's originally dirt on the surface or not. If there is originally dirt, you need to clean the dirt off first. And just speaking of electronics, I would always recommend that whatever you're going to wipe down your electronics with, you spray what you're going to use onto a clean cloth and you wipe it with the cloth. Please do not spray anything directly onto your electronic goods.
Oh, wonderful. What an informative session it has been. You know, before the actual lockdown, when it was announced, we saw people flocking into the shops buying in bulk. And we know there are expiry dates on those products. So what can you say about cleaning chemicals, sanitizers that have passed the expiry dates? Do I need to throw them away? Can I still use them?
Okay, so cleaning products that have expiry dates, generally disinfectants do not expire very quickly. So with the exception of possibly a bleach, and that would depend on how well it is stored and how hot it is. So there are so many variables that can happen, that can have an effect. Those recommendations are there, assuming that things are properly stored and you can use them. But what I can tell you is a lot of disinfectants are things that kill bacteria. So because they kill bacteria, they don't go off. So they can have possibly a longer shelf life. However, you would not know that without actually testing for it. So, but you shouldn't see that those bulk purchases, the shelf life should be reasonably long on them if it's a disinfectant that you purchased. And if it's a hand soap or dishwashing liquid or one of those, you always know if they go off, they smell like rotten eggs. So you will know when you can't use it anymore.
Okay. All right. Thank you very much for the session. I will allow Jean to close. And there was a question on the availability of slides. I will allow her to respond to that. Thank you so much. Thank you.
Thank you, ladies. Let me come off mute. Can you hear me? Thank you, ladies. That was fantastic. Disinfectants, can you just say a little bit about your company? I think we've heard about Blendwell. Can you just say a bit about yours?
Okay, the company is Disassembling Consulting Corporation. We are a company that does safety management and environmental management. Safety management from training the staff, provision of PPE, and doing a risk assessment. Generally, you don't just go and take a PPE that you want to use. You do a risk assessment and you determine this is the kind of PPE that will be required for this specific kind of a task. So that's the information that we provide. In terms of environmental management, we do respond to spills, waste management. I mean, when you store bulk chemicals on your site, there is a specific requirement that you need to comply to. And that's what the kind of advice and assistance that we provide. Thank you.
Thank you, ladies. That was very informative. Judy, I learned a lot of things that I didn't know. I have been washing my fruit and veg and wiping all the plastics. Actually, I was amazed at how long the virus lives on plastic. That was quite a shock for me. Thank you so much, ladies. We will be sharing the slides for everybody who registered for the webinar. We'll share the slides and the recording. We're recording live. So thank you so much, Judy and Disassembling. We really appreciate your expertise in sharing with us. And that's it. We're right on time. So we're going to close now. Thank you for everybody who joined. We really appreciate your support at this time. Everybody, please stay safe. Bye-bye.
Bye. Thank you. Bye-bye.